Hundreds turned away at ICUs. Intensive care units across the country were unable to admit hundreds of referred patients because of inadequate resources during the COVID-19 pandemic, with doctors and nurses forced to care for some patients who needed critical care on wards. Leisa, this is an alarming story that's breaking tonight because I know in WA they're cancelling all types of surgery tomorrow because the vast majority of nurses are walking off the job in a pay dispute with the state government that's sitting on a $5 billion budget. But hey, so it's interesting. It's going to be fascinating to see how this goes down around the country tomorrow when it comes to our nurses who are just demanding better care and specifically on ICU wards.
Yeah, Jenna, and look, we talk about health every time I'm on this program with you, where health is front page, at least in one state or territory across this country, if not many. So here we are again, and the figures in this, when you dig down into what that story is tomorrow, are quite shocking. And I guess it really... It shows what we all suspected during COVID, that the hospital system was not coping. But when you see figures that 1 out of every 10 patient that was meant to be referred onto an ICU, that there wasn't availability for them, they couldn't get into an ICU, and doctors and nurses were then having to deal with that and care for them in wards or wherever they could, that is appalling. Like, I know the hospital system, and in Queensland we have issues. Goodness knows in Victoria, if they don't, vote against Daniel Andrews for his handling of the healthcare system down there, I don't know what is going on in that state. But like I said, every week it's front and centre, and these figures are just absolutely shocking.